Hey, it's Dr. Thornell with New England Family Chiropractic. What I want to do today is we're going to continue our lessons on how to use a massage ball or a baseball or a softball or a dog toy that has some flexibility to it. Anything that's basically this size with a little bit of flexibility. A tennis ball is too soft, and a baseball, you can certainly try it, baseball, softball. They're a little firmer than would be ideal, but they certainly work. So I'm going to show you, we're going to talk today about how to use these on your lower back and your hips in a couple of specific ways. So the first one we want to talk about is the psoas muscle. The psoas muscle, if we look at somebody from behind here in my drawing, the psoas muscle actually begins on the front part of your thigh, and it comes in through the inside of your pelvis and then works its way from the front of your thigh towards the back of your body and comes up and starts to attach along your spine. So when you go to get out of a chair, when you're sore, or if you've been sitting too long, you go to get out of a chair and you can't stand up quite all the way until you take 3 or 4 strides and then we can stand up. That's your psoas muscle being tight. So what we're going to show you today with the balls is how to work on the psoas muscle on both the back side of it and the front side. And then we're going to get down into what I've drawn out in red here, which is called the QL, or the quadratus lumborum muscle. This is sort of a fan-shaped muscle that comes straight across your lower back, starts at the spine and then reaches out on either side and comes around the hip. So when we do the QL, we want to work all the way across the top of your hip bones. As you come across the top of your glute muscles back here, you'll feel bone underneath there, and then it sort of rounds off on the side. And that's all this QL and then the top part of the glute muscles. And those are really important, that when they get tight, you feel a lot of pressure down here into your lower back. So those are the 2 muscles we're going to focus on. Just give you a couple of quick ways to do that. And the major thing that I want to tell people and hope that you understand is you absolutely have time to do this sort of soft tissue work. A lot of people say, well, I work a lot and then I get home, I just want to relax. That relax time is time to do your soft tissue work. If you keep a couple of balls in your living room or wherever you watch TV at night, when the commercials come on, you hop up and you do 2 minutes or 3 minutes and work maybe the left side, the first commercials, the right side, the second commercials. And as long as you're consistent with that, you're going to get in plenty of soft tissue work to help keep these muscles flexible and pliable. So these are the areas we're targeting. What we'll do next is actually show you how to get at them using the massage balls. So here we go, talking about how to actually get at the psoas muscle and the QL muscle. We're going to start on the back side, so you can just simply lay on your back and we can work both of the QL, the upper glutes, and the psoas muscle from the back side. When you utilize the massage balls, it's meant to be uncomfortable. What we're trying to do is get at muscles and tissues that have become fibrosed, meaning they've started to grow themselves together. All the tissues within our body are supposed to have a glide factor. We're supposed to have individual muscle fibers are supposed to be able to glide within the muscle. The muscle is supposed to glide separate from the tendons and tissues around it. And when an area becomes stiff and immobile for a long period of time, they start to grow together. They form these adhesions that lock them together. So part of what we're doing is breaking that up, and that's not necessarily a comfortable process. So expect this to be a little bit definitely painful, to a small degree painful. We don't want to go overboard. We want to be able to stay relaxed and handle the level of pain. We want it to be uncomfortable. When it's uncomfortable, we know we're in a spot that needs this type of work. But don't kill yourself. We have to be able to relax at the same time. So if it's so painful that you can't relax, then you're doing it improperly. So what we're going to do, we're just simply going to lay on your back. Again, you kept the ball in your TV room and the commercial comes on, you hit the floor. This table is okay to use because it is soft, but it's not very soft. Like you couldn't do this on a mattress. So doing it on the floor is perfect. So we just hit the floor. You're going to bend your knees. And all we're going to do is start with the QL and the upper glute part. We pick up, we're going to put that ball into the fleshy part of a muscle on the top part of your rear end and glute muscle there. And then simply lower your weight down onto the ball. And we want to only lower as much as we can to make that comfortable. If that's too uncomfortable, all I'm going to do is simply lean off to the opposite side slightly, and then as I can, over a couple of seconds, work towards bringing my knees back over the ball so that my weight is transferred onto the top of the ball and we're getting more squeeze on that muscle. Once I get to a sore spot, I want to spend about 10 to 20 seconds with that pressure on there. Then I'm going to lean back to the other side, and I'm simply going to move the ball maybe a half an inch further out, up, down. I'm just going to move it around within that same muscle and then roll the pressure of my body back onto it again. And when we've done that to where we know where that muscle actually lies, I can lean over there, and then I can just sort of rock my hips back and forth and get that ball rolling underneath that fleshy muscle. What we don't want to do is roll across bone, because that can be damaging and pretty uncomfortable. So we're going to work all around the top part of that glute. Remember that the muscle actually comes all the way over to the side over here. So we get it way out on the side and lean over on top of it. That tends to be a really sore area for a lot of people. Then we're going to come up above the top of the pelvic bone and get to that QL, specifically separated from the glute muscle. Same thing, I'm going to find where the muscle is. Once I'm comfortable with where the muscle is, I can roll just a little bit, making sure not to pinch any of the bone and the tissue between the ball and the bone, because again, that's pretty darn uncomfortable. And then simply, we're going to come up and more along the spine. We're going to find that QL muscle, and the QL runs from the inside of your pelvis all the way up underneath the base of your rib cage. So you can go pretty far up your spine with this. Once you get into the ribs, that's time to stop. We don't want to go that high. And then to isolate the QL, here's a really cool move that we can do. We have that pressure on the ball already is pushing into that muscle. For me, this is a pretty good stretch right there. And then simply, to get the muscle moving on top of the ball, all I have to do is bring my knee up a little bit and extend the leg out and just work back and forth like that. I might do that 3 or 4 times, and then we're going to move the ball slightly higher, roll the pressure back on top of it again, and then we just move that leg back and forth. And what we're doing is getting the muscle moving along the surface of the ball like that, giving us a lot of great friction to break up a lot of those fibers all at one time. So all you have to do, commercial comes on, you hit the floor, start down on your glute muscle, work to the outside, move it up above the crest of the pelvic bone there, work along the QL, and then come up into the psoas muscle and work along the spine all the way up till we hit the base of the rib cage. And when we're working that psoas muscle along the spine, just moving that leg back and forth will give you a really nice, comfortable glide across the top of that muscle. So that's how we can utilize those balls to keep your lower back and your glute muscles flexible and pliable.